I think a lot of people in this community are very desperate for our services. They really do want our help. So it's also interesting, like our scope of practices are different, but we still focus on the same thing.
Let's take this opportunity to use this as our practice run, and then we can take IPE further. I'm Dr. Renata Eccles. I am a speech language therapist. I'm a senior lecturer in the Department of Speech Language Pathology and Audiology at the University of Pretoria, South Africa, and I am involved with the IPE theme as part of the Dirisana Plus project, and we are looking to encourage IPECP, interprofessional education and collaborative practice, at Daspoort Polyclinic. The Polyclinic in Daspoort was started by the University of Pretoria in the 60s, and it is supposed to be a clinic that is run by students for the immediate community. It's got a diverse amount of things going on. A lot of what we want to aim to do is health promotion, but also when a difficulty has already occurred, it is the treatment of that with the family and the client.
The nurses, usually nurses see patients who come for acute illnesses, pregnant ladies, and also immunization for the babies.
So we're currently at Daspoort Polyclinic for the University of Pretoria. We provide speech therapy services in this shack. It's not much, but we make do with what we have. So at the moment we're going to see a patient, and we basically focus on speech and communication skills, as well as how you interact with other people, as well as your language development, because communication does form an important part of life. If you're not able to communicate with others, ultimately you'll become frustrated, and we don't want that to be the result at the end of the day.
So I'm also a student coordinator for the clinic. When the student comes from the University of Pretoria, all the disciplines, maybe we've got about 10 disciplines that are coming. I usually orientate them about the clinic, show them around to where they must go and work, and what kind of work they must do in Daspoort, from what time to what time, which days, Monday to Fridays.
And this is so valuable experience and insight in what people are actually dealing with, because we go to university, we are the lucky ones out of this country. We don't deal with real life hardships because we get to be educated. So it's just nice to have this community connection now already.
So on Thursdays there's multidisciplinary case presentations where each profession gets an opportunity. And for example, when it's our turn to talk, the supervisor will discuss with the students who has a case that would be interesting to share. So it has to have aspects that have multidisciplinary inputs. And you would present the case. So you would say, well, this is the case, this is the background, this is what we know from the case history. Then this was our assessment. So we do try and do it according to the ICF outline, with the body functions and structures, activities and participations, barriers and facilitators. Because what happens then is it gets passed back to the audience, and then each profession has to say, and in our therapy what we've been doing is. So the University of Pretoria has shown great support for interprofessional, the movement towards interprofessional collaboration. In the faculty, there's definitely conversation about IPECP, there's definitely commitment to it. There has been a call to formally put the IPECP core competency teaching into all theoretical teaching. That is not a formalized call, it has been a discussion between team members to do. And so we are all trying to do that now, and it's between the allies, it's the conversation we're having. The medical, the doctors are also trying to come on board, nursing's on board with us, in these shared, what we call shared module meetings, where we have these kind of conversations. The implementation, of course, is hard into practice, into practicals, and that's what we are trying to brainstorm. There is interprofessional collaboration or multidisciplinary learning taking place in the integrated health leadership modules, which happen in first, second, and third year. But that is for community engagement projects and seeing the community as a stakeholder and a participant in your community project with you, that you shouldn't tell them what you are here to do, how to do a needs analysis and get to what a community needs and how to include them in the implementation, so that we no longer have this idea of external people going in as agents of change and empowering a community, but rather being a catalyst for what a community already wanted.
There's also stakeholders around the area that comes and join us here and maybe tell us about their challenges in the community. And then those challenges as a clinic, we know that we can help them from the clinic side, that these ones we can help. COSUP, Community Substance Use Program, whereby you find that these guys are working with the people who are using drugs, and they're checking their stats, what's happening with their stats. They want to make sure that everything is up to date.
It's nice to work with you guys because we know that we're holistically making a difference to that client's life.
This collaboration will also contribute to the overall healthcare system with referrals.
Because I've seen this before, then you can refer properly, and I feel like that just educates us in such a healthy and good way that I really enjoy.
So if we look at the mission, I cannot quote the mission of Dirisana to you, but the mission and the vision, it's about this collaboration between health professionals from the northern hemisphere and the southern hemisphere to have better student outcomes. Mamelodi, Skinner, a whole bunch, right? So we are all coming together to kind of brainstorm how to do these kind of collaborations and put our heads together, and they've come from SMU on Monday, Wits yesterday, they're going to UNAM in Namibia and Welwitchia on Friday. So it's really everybody discussing interprofessional. So it's very exciting. And therefore to have a knock-on effect for the communities we see and treat, or the way that we train students. And we know that IPE is got the best outcomes for a patient or a client and for their family. It helps recovery in a more functional way to benefit the community. And it has better fulfillment for clinicians because they see more functional outcomes. And when we looked at all the things in Dirisana and the aims, a lot of it was interprofessional. So that interprofessional collaboration of sharing to achieve more, or asking someone or a community or a student what they want, and then each profession standing up and saying, well, this is what I can do to help you achieve that, makes us all go much further when we go together. So it aligned well with the vision and this kind of, the whole point is to have this collaboration. That's what Dirisana is. So taking it forward to show students, or facilitates that students can do that for the people they will see and treat, is part of the job we do as lecturers.
So it's nice now, like coming to the clinic and actually working together to make a difference.
Yes. And that's what I really appreciate about this specific Daspoort block.